obviously the whole system is going to change to some extent at the end of this. So it's fascinating to see what kind of considerations are made, because a big part of it's going to be understanding and being prepared for the next situation that arrives. This is very clearly just the start of our infectious disease concerns and spreads going forward. Doc, could you highlight, maybe with that in mind, what some of the technologies are that we're implementing in the public health practice that are going to be useful resources as we try to stay more prepared going forward?
In public health space, I think this, idea of the modeling techniques and the parameters, like studies like ours, maybe feeding into the actual epidemiological modeling techniques. But really, I think there is going to be more and more effort and more need for data reporting. And we have the capability to do this. It's just that, maybe we were never prepared to do this at such large scale. But relaying information, collecting data in a standardized way, whether it's about hospitalizations, the severity of them, whether it's about race and ethnicity reporting in hospitalizations, it's just done in such sparse and disintegrated ways that make decision-making really difficult. So I think thinking about the large-scale data surveillance and being able to use that in decision-making is going to be something that we need to be really thinking hard about. And of course, that going back to the contact tracing issue, and it's done on a person-to-person basis, which is one way to do it. But I think we have a lot of technologies at our hand to be able to reach out to people and get information in real time through various apps and other sort of feeds into both the public health system as well as EHR system. That's another, I think, area in technology that we need to be working on, increasing that connectivity between the public health and the delivery sector and the payment sector that I think will really need to come together.
Yeah. It sounds like there needs to be understanding at the level of preparedness and okay, what do we have stocked and ready to go, that in that conversation, monitoring capability needs to be prioritized, data collection needs to be prioritized in a way that people, I think because of the nature of our healthcare system, people are inclined to immediately put into like the retrospective category of like, okay, we'll go back and look at how this was going after the fact, and then we improve upon our practices. This is something that hasn't really been pushed to the immediacy level.
Yep, I agree with you. Some more proactive data collection, more real-time data collection, and more standardized data collection are needed.
And any good workarounds that you can think of? I mean, you mentioned obviously differentiation of privacy rights and consenting individuals into this kind of global health situation can obviously muddy it up. Is there any way we can, I guess, find a good resolution for both invested parties in that?
I think it will have to come out from buy-in from both sides. And I think to the extent that people may realize and the data that comes through them is shared, but that it's shared in a trustworthy way that protects their privacy, probably people will be more willing to contribute. And, in some of the other sort of related but unrelated research that we know that sometimes people are not necessarily engaging with the healthcare system because of trust issues, that's for sure. But also sometimes people are not engaging in terms of, providing their data, providing their patient reported outcomes, for example, because they don't see the action back. And I think that's another problem to be solved. And, in a pandemic, you would hope that any data I provide becomes actionable, and that it's actionable. It creates an alert in the system, and a physician can act on it, or a policymaker can act on it. So I think that link between, as we are moving into collecting more data from individuals, as we are releasing more data, that we need this data to inform our decision making, both on the business, policy, and practical clinical side, that people that know and trust that is actionable, that what they're providing makes a difference.